Hi, I'm Dr. Peggy Semingson, Assistant Professor of Curriculum and Instruction at the University of Texas at Arlington.
And I'm Evie Malaia, Assistant Professor of Mind, Brain, and Education, same university.
And we're going to be sharing ideas and information, drawing on a mind-brain education perspective about the topic of dyslexia. So I have 4 questions, and the first one is, what is the definition of dyslexia?
Dyslexia fundamentally is the neurologically based disorder which interferes with learning of fluent reading. It can be based on different fundamental differences in neurological makeup, so it can manifest in different ways, but in general the overall effect is that fluent reading for people with dyslexia is not possible. It is also genetically based, so sometimes you see clusters of dyslexia in families.
Are there different types of dyslexia?
Absolutely. So as I said, there might be different pieces that don't fall into place for the person to learn to read fluently. You can think of it as kind of a pyramid based on some very, very basic skills, such as ability to pick out something that's black on a white background, or the ability to identify separate sounds in speech. And all of these very, very small skills finally build up so that you see over a surface the overall ability to read fluently. So when the person who is of normal or often above normal intelligence cannot over time learn to read at certain speed with certain accuracy, that's when we say we're probably dealing with dyslexia.
Okay, thank you. And then what are indicators classroom teachers or maybe parents and families can look for?
There's not a single indicator you could look for, just because dyslexia is so multifaceted. Some basic things that are frequently early indicators of dyslexia are difficulty with orientation of letters or numbers. So it is very often that younger kids, pre-K and kindergarten, print numbers like 5, 7, or 2 the other way around. But when that type of writing persists, or when kids have trouble differentiating B from D for a very long time, that's a very typical indicator of dyslexia. Dyslexia is often co-occurring with attention deficit hyperactivity disorder, so sometimes you will see difficulty in focusing attention on reading, so that's also a very typical indicator. And finally, that would be the easiest giveaway. Unfortunately, that doesn't occur very often. Kids can just tell you that they can't pick out the shape, or they can't replicate the outline of the letter on a paper by the time they're 4 or 5 years old. So the most important thing at that point is to send the kid in for diagnostics, because while we know that the overall effect is inability to learn fluently, the most important thing is to figure out what particular aspect in building up that higher cognitive skill is off, and help the kid to develop strategies to get around it.
Okay, thanks. And then how are students typically diagnosed?
Well, the basic diagnosis is we have to rule out everything else that can be contributing to the inability to read fluently. So need to rule out the ADHD just as a separate disorder. Need to rule out any sort of vision difficulties that are separate. Need to rule out any sort of hearing difficulties. So that's why it's difficult to diagnose fully dyslexia at the school level. It's best to get professional assessment for all those specific perceptual and cognitive skills, intelligence early on. Then we can talk about dyslexia, and that's the point where it's best to start early to develop ways around the specific skill that's impaired.
Okay, I know that schools typically do screening instruments, so you're talking about a more in-depth diagnostic test beyond the screening.
Yeah, screening is helpful in terms of, okay, at some point we're having kids learn to read, and then around age 7, 8, we expect kids to have learned how to read, and then we expect them to read in order to learn. this is where things break down for kids with dyslexia. A lot of them can sort of hang on with the curriculum while they're still learning to read. But if the fluency never comes in, they have difficulty extracting information at the speed that they would be able to comprehend it. So at that point is typically when everybody realizes something is really wrong. It's possible to start figuring that out early and try to look at possible assistive technologies. One specific aspect of dyslexia, for instance, is the difficulty in looking at what we call low-frequency visual information. So low-frequency visual information is just very, very small print. Some kids benefit from increase in print. If you put the reading onto an iPad and increase the font, for some kids, that's what helps. It won't help every kid with dyslexia. But a specific subpopulation will benefit from it. So it's looking for what's the difficulty, can we get around it, and getting around it. That's what's needed.
Okay, that's really helpful. And then also, what are some types, I know this is a more challenging question, but what are the types of instructional strategies teachers can think about implementing when working with students with dyslexia?
Students with dyslexia are typically pretty sharp. They develop their own strategies that actually hide their dyslexia. So for instance, a kid with dyslexia might try to rely on an overall shape of the word instead of reading the whole word. So if they know the topic, they can mimic reading beautifully by just recognizing the shape of the word and saying it out loud. A lot of them have fantastic auditory memory. They hear the book once, they'll remember the whole book. That's one of the difficulties in teaching them to read because, it's impossible to give them the same book twice. They won't read it, but they look like they are. So the strategies are, you're ending up working with each kid individually with dyslexia, but you are letting them take the stronger skill and use that in learning instead of trying to push for something they're not capable of, and it's not the teacher's fault they're not capable of it, and it really isn't the student's fault. But we're saying it's neurological disorder. It's not possible to push it if the neural connection is not there. But it's possible to get around it, and a lot of people with dyslexia are very, very successful, and they are very good at getting information in auditory ways or otherwise, so that they might, never need to read fluently.
So would you call that compensating?
Yes,
okay.
Absolutely.
Yeah, finding strengths.
Yeah,
okay.
And kids with dyslexia are very, very good at learning to do it, and they'll probably show you how they can. It's just the question of finding the time to individually talk to them. And it's usually not just the teacher's not the only one. Usually the parents have to get on board with it. The school has to be flexible enough to allow to integrate these kids into the classroom, even though they have entirely different learning pattern.
So it makes sense. Yeah, it makes sense just to have conversations with families about the strengths and then build on those, like visuals, like with visual strengths auditory strengths, like
absolutely.
Books on digital,
books on tape,
Audible, audio, is it audible.com or those types of resources? Okay, those are good, and those are things we can do something about.
Yeah.
Is there anything else you want to add from a mind-brain perspective?
We are still learning a lot about dyslexia. We're trying to understand the little pieces that can result in the overall higher level cognitive impairment, and these things help us learn a lot about kids who are neurotypical, as we would say, are learning to read. So even though the kids with dyslexia, have it harder than everybody else, they're helping us learn best ways to teach everybody else. So as a neuroscientist, I'm frankly very grateful to them.
Good. Some resources are, in the state of Texas, we have the Dyslexia Handbook, which is undergoing revision, and we'll have a 2014 edition soon. The International Dyslexia Association, IDA, is a good resource for information. Can you think of any other books or resources or anything?
Yes, there is a book, Learning Outside the Lines, that is written by two Ivy League graduates, one of whom has ADHD, the other one has a learning disability, dyslexia being part of it. And you can see how it's possible to be successful in an Ivy League college level. Even though you might have dyslexia or any other learning disability, it's possible. The whole thing is strategies.
Okay, well, thanks for your information, and we encourage everyone to keep learning about this crucial topic.